June, House Healthcare, January 16th. And today we're getting sort of an overview from our staff at Legislative Council, Jen Kirby, Judy McClinton. So welcome.
Thank you. Thank you. So our game plan for today is to officially, for the record, Katie McClinton, Office of Legislative Council. For Kirby, Office of Legislative Council. Now, our game plan is to tell you a little bit about the office. I know a lot of you are veterans and know a lot about our office already, but hopefully we'll tell you something you don't already know. We're going to walk through how to read a bill as a refresher, and we're also going to spend some time looking at the website so you know where to find all of that important information, like the work that your committee is doing and how to take a look at the statutes that have already been enacted. And assuming we still have time, which I hope we will, we have put a chart together of all of the reports due to this committee since you adjourned this summer. So we'll take a look at those reports, refresh your memory, and give you some light reading material for your evening.
Yes, there are links and everything that's come in so far, so hopefully it will be user-friendly.
Okay, so what is the Office of Legislative Counsel? We are an office of 18 attorneys. We all have different areas of expertise, subject matter-wise. As you know, you'll be seeing a lot of Jen, you'll be seeing some of me, but we're probably the two main attorneys that you'll be seeing in this committee. We are a nonpartisan staff, so we serve all members of the General Assembly, regardless of political affiliation, regardless of your policy agenda. Our goal is to do the very best work for each member that we can do. And with the bill that you've introduced or the research you've requested, you can pursue your own policy agenda.
I like to say we arm all sides and then stand back and watch you fight it out. That's what we do.
I see you're smiling in the corner there.
It's fun.
This year, we're trying a new experiment. As you know, we have a new director that started this summer, and that's Bryn Hare. And she has organized the attorneys into teams. So Jen and I are a team of five attorneys who cover healthcare, human services, education, finance, and tax.
Oh, good for you.
And tax. And tax.
That's a big brief.
That's a big, so the idea is not that Jen and I are going to become experts on education finance this session or any future session, but the idea is that we have some familiarity with the portfolio of the members of our team, and that we can provide mentorship for new attorneys on our team and also help provide a little bit of coverage for each other. Historically, it's been hard to take a day off during a session if you are sick. So we're hoping that we'll be using this team structure to, get another attorney into the room if an attorney has to be out. So what that means for you is probably not a whole lot. You'll still be seeing Jen and I like you always do. In the event neither of us are available, you might be seeing somebody on our team show up and walk through a bill if one of us isn't available.
And the others on our team are Beth St. James, who handles education, John Gray, who's handling education finance, and Kirby Keaton, who some of you will remember from last year, and he handles the tax portfolio. I just say some of you remember because he was in here a few times. Mm-hmm. So as far as who covers what in the between Katie and me in this committee and the committee down the hall, the Human Services Committee, that we also spend most of our time in, we wanted to just give you a little bit of a sense of who does what. As Katie said, you'll probably be seeing more of me in here, and Human Services will be seeing more of Katie. But what you'll be seeing us for in here on issues of dental health, we're kind of sharing those. They don't come up too much. I've handled them recently, but Katie has been getting into that area as well. So dental health could be either one of us. Healthcare administration, things having to do with the Green Mountain Care Board and its regulatory activities, Department of Financial Regulation and its regulatory activities. DEVA, others will probably be me. I'll be in here on healthcare facility issues, unless they're mental health facilities, in which case you'll see Katie. I do healthcare finance, so including various taxes that support specifically healthcare purposes or related to healthcare. Healthcare professionals, so board of medical practice, office of professional regulation as it relates to healthcare professionals, except again, mental health professionals, and there is a whole list of those in the statutes. Katie handles those. Also substance use disorder. I cover healthcare reform, health information technology, health insurance, Medicaid, legally protected healthcare activities is sort of the umbrella term that was given a couple of years ago to some abortion and reproductive care and gender affirming care. And for those of you who were here, you may remember you saw Michelle and me and Ameren at the time, but it's mostly healthcare in this committee. But there's some parallel work being done in the judiciary committees, and Michelle works on that. Katie, you want to talk about mental health?
Sure. I cover mental health, so that pertains to the physical facilities where mental health could be delivered, the system of care, involuntary commitment, involuntary medication. I touch on the DAs and the SSAs, designated agencies and specialized service agencies. So those would all be topics that I cover. Do you want to?
I cover most of prescription drugs. So that includes prescribing, prescription drugs themselves, price transparency, pharmacy benefit managers, which we've been doing a lot of work in this committee on in the last several years. Sort of the shorthand version that I use is if somebody is using prescription drugs as they were intended to be used, I cover it. If somebody is using prescription drugs in a way that are not intended to be used, Katie, who handles substance use disorder, will cover that. So,
and that will usually be next door. It usually doesn't come to this committee.
Yes.
And I also cover public health in this committee. So issues like communicable diseases, immunizations, lead poisoning prevention, and environmental health issues come to me.
What we do with human services, I don't think. And feel free to stop us if you have any questions. This is just supposed to be helpful. So I'm going to now, we're not pivoting. We draft, as I think you know, we draft all the bills and amendments that you will see. So some of them are getting introduced already by individual members and they're appearing on the wall when they get referred to this committee. We'll also work with the committee, work with you in this group to amend the bills that you want to take up or to draft committee bills if the committee is on a topic that it wants to take up and you want to develop your own legislation. So we will draft all of the bills and amendments. And then when bills go to the floor, we also draft amendments for other members so that they can propose to amend a bill that you have voted out. So sometimes you'll see people proposing to do things that you'd considered in committee and decided not to do, but we're still going to draft that amendment for them, and then they get to make their pitch and see where it goes from there. We also follow the same bills that we draft to every committee they go to. So a lot of bills that come out of this committee may get referred to Ways and Means across the hall or appropriations, and we go to those committees and help them understand the bill and make any amendments that they want to the bill. And then we do the whole thing all over again with the same bill in the Senate. And the same thing when bills originate in the Senate and come over here. We also do legal and policy research for you, both as members of the committee and as legislators. Generally, we work, as Katie said, for all 180 of you, regardless of what your position is on any particular issue or your political party. And so that comes with doing research on things that you are interested in pursuing legislatively. We also prepare some summary documents upon request, so we don't do them as a matter of course, but upon request, when bills are voted out of committee, we may prepare a section by section summary. That's often the case, particularly if it's a long and complicated bill. We try to help you make sure you understand in plain English what the bill does. Did you want to add on those?
No.
Okay. Confidentiality, we do have individual confidentiality with each one of you. So what we do in the committee setting is not confidential. It's being broadcast on YouTube, and it's being done in public. But when you want to talk to us about an issue concern you have, a bill you want to work on, or you email us or talk to us in person or call us on the phone, that's all confidential unless you tell us it's not. And sometimes we may ask you if we can talk to a particular person who has a lot of information that we think would be helpful in answering your question. But you can talk to us, and it's, as long as it's about legislative work, it's confidential. If we're talking about the weather, I might tell somebody else, you thought it was a nice day. I'm not going to tell them what bill you're working on.
Can I interrupt really quickly?
Yeah.
And can everyone check their iPads and make sure that they're muted or turned down all the way? Since we're all getting a flurry of emails. And I know the mic picks up and much louder than actually in the room. Thanks. Sorry, Jen.
No, turn over to Katie for a minute.
So as, well, maybe new, returning members don't know, but, most of the legal staff has moved their office location over the summer. So now the best place to find the members of our team are, the green building, kind of kitty corner from the State House, it's 2 Aiken. So that is where physically you can find us, but the best way to contact us is always email. That's going to get the fastest response. And you should know that because we're just a tiny bit further than we used to be, you have to give us a little bit more of a warning when you need us to run over. It'll take a little bit longer. So yeah, email is the best way to get a hold of us.
All right, so we are now going to look at a couple of bills and how to read a bill. So we're going to look at one first that we're actually doing a walkthrough of tomorrow. It's already been referred to your committee. So we're not going to look at the contents. We're not going to talk about what's in the bill, but we're just going to look at the structure. And then I'm going to show you another one so that you can see a different stage of a bill. So thank you, Kristen. I already had sharing access. That's great. All right, so this is a bill as introduced, and you can see on it, it starts at the top. Well, at the very top, it has the bill as introduced and the year and what number it is. And then it has the bill number, who it's introduced by. This bill was introduced by the chair, Representative Black. It has a blank space for where it was referred to and the date, because the clerk's office handwrites those on their copy of the bill on the official version. There are a number of subjects, and this is generally our attempt to kind of distill what's in the bill into a word or a couple of word phrases so that it's easy for somebody who is looking up a bill to put in any of these words or phrases in the keyword search and pull up this bill. So if anybody's looking for all the bills on health and they put in health, it should pull this up.
I knew I was going to learn something new. So when you do a search for a bill on our legislative General Assembly page, if you don't have one of the words that's in just the subject, will it not pull up the bill, or is it the body of the bill? I guess I always thought that it does not search the body of the bill unless you do a full text search on the search page. Okay.
But if you type in, it should be populated with these keywords if you search on the home page, and we're going to look at the home page and some searching in a couple of minutes.
It can be a little bit tricky because, as you know, the content of a bill changes over time. So these subjects are set at the time that the attorney is first writing the first draft of the bill. So if it becomes, I'm trying to think.
If we put pharmacy benefit managers in here as an amendment, that's probably not going to come up if you search it at a later stage.
Yeah.
Great thing.
Might be why I have a hard time finding bills. Thanks for telling me that.
Yes, but we can look at some ways to find bills when we get to it. And that actually is a good lead into this statement of purpose of bill as introduced. Again, this is something our office controls. We make a summary, a plain language summary of what the bill would do as introduced. This does not change. So if if you take up this bill and you strike everything out of it and put something new in, and H31 moves along through the process, we never come back and update the statement of purpose of bill as introduced, because it's just as the bill was introduced. And that's partly why we will look at an as passed House version from last year in a minute. So we try to put kind of the general concepts If it's a fairly short bill, it might be a little bit more specific. This is fairly specific because there's only 2 substantive sections to the bill. But if it's a 50-page bill or a 100-page bill, if there's a whole lot of different topics in it, it may not be practical to spell them all out in here, but we try to give a flavor of what is in the bill, and then there's more specificity in the bill language itself. We also know sometimes what you see in the statutory language of the bill doesn't necessarily make a whole lot of sense out of context. So this statement of purpose can be helpful in telling you what the bill would do. And then we have the title of the bill. So there's always a big gap here, and then the title, and they all start with an act relating to. And then we try to put it, again, a title, we pick the title, it's supposed to be objective, plain language, and just a really short distillation of what the bill is about. Enough specificity to let the reader distinguish it from other bills. So an act relating to health insurance, we could have 50 of those. You would not know what any of them did that was different from any other ones, but not so specific that it's, 6 lines of narrative. Then all of the bills per the Vermont Constitution start with, it is hereby enacted by the General Assembly of the state of Vermont. And then it goes into the bill sections. And this bill has 3 sections. The first 2 of them are what we call statute. They are, in this case, amending. We can amend or add statute. And so this is telling us that we are looking in Title 18. There are certain titles you will be working in a lot in this committee. The main ones are 8, which has health insurance in it, 18, which has a whole lot of different health-related topics, and sometimes 33, because that's where Medicaid and the exchange statutes are. So in this case, we're saying we would be amending Title 18 of the Vermont statutes annotated, and we're going into section, that squiggly sign is the section symbol, section 9418A, and it already exists, so we're amending it. We're saying it's being amended to read. And all of these titles here are those green books, and I think Katie's going to talk to you a little bit about that, but those are the green books back there, and I should stop and let you do that.
No, could I, you're doing great. Can I just say, so on, well, you can't see where I'm pointing. So on line 15, Jen just pointed out that the word amended is there because we're making changes to an existing section. You'll also see lead-in language that says section XYZ is added to read, and that's how you know we're adding a brand new section and we're not changing an existing section. There are other ways to know that too, but
Other cues
that's
too.
one of the keys.
Oh, 2.
Yeah.
But so I'm just going to show you to start with. We have 3, as I said, 3 sections. So section 1 has been going on for a bit. Katie's going to talk to you a bit about that. Section 2, and again, we're back into Title 18, but a different section also being amended. And then in section 3, this is our effective date section. And Katie's going to talk to you a little bit about why those appear different as she goes through. So I'll let you can scroll through.
Before I jump into the statute and section law. So on line 18, do you see there are 3 stars there? Yeah. So those are important because that indicates that there's language in statute that you are not looking at and not amending. And that is sort of like a placeholder to let you know the language is there, but it's not changing. And the reason we do that, well, we could do it for many different reasons, but often an existing statute, it could be very, very long and just take up pages of your bill, and it's not really the focus of the bill that you're working on. So instead of having pages of sort of irrelevant text, we'll put those stars there to help focus us on the language that we're working with without indicating that we're getting rid of the language that is currently in statute. So that's why you'll see it.
Easy.
Because not everyone in the room is familiar with it, would you explain the section and title reference language in line 15?
Yeah.
Yes.
Okay.
Yes, before we get to that, I just want to finish the thought a little bit on these. We call them either 3 little asterisks or ellipses. And as Katie said, it's basically saying there's more here. We're just not showing it, but we're not touching it. So if all these changes that are in the bill get enacted, then the language that is where those 3 asterisks are will continue to exist in the statute in the same form that they currently are.
And I will just say, because I struggled with this, oftentimes we will have questions and we're like, well, what about that? And, oh, shouldn't we say something about that? And it's often in those three ellipses, it's already in statute and.
Right, and sometimes we'll pull out the rest of the statute to show you what's already there, or it might make sense to pull in that language and not do the ellipses so that everyone can see it. And sometimes we'll put in language for context, even though it's not being amended, or because it answers important questions about what about XYZ that's already addressed.
And Leslie?
Same,
Oh, okay.
because that was the idea that of context,
Yeah.
and that if it's important, you'll put it there. And if it's, I always made the assumption that you don't think I need to read that. Is that fair?
Yes, I think if we use the ellipses, it's generally that it's not particularly important to understanding what is being done in this section.
Good,
In the rest of it.
that's helpful.
Sometimes it's a judgment call, sometimes it's a page count issue. You know, the whole statute may be important, but not in a way that means you need to be able to be looking at it. in order
We can
to-
depend on you to say, you need to know why the context. No, you're excellent, there's no doubt about it, but, okay, just clarifying.
And another, just for new people, the lines, all the numbered lines,
Line numbers.
that's how we sort of, when we're doing walkthroughs.
Yes.
There's a lot of what line or what page are we on?
Yes, they're very helpful for that. Oh, I was talking about something.
Oh, I'm sorry.
I was talking about on line 15,
Yeah,
it says
I'll get
section
there.
when you can do six.
I'll get there, I promise. So what I wanted to talk about before we look at that, but we will go there right now, is you'll hear us sometimes call things session law, or we might talk about the green books, which are literally those green books behind you. And we sort of make these comments that distinguish about different types of law. So we have the law that's codified in the green books, and we also have session law that is not codified in the green books. So what does that mean? If there is, first I should say, both are law, both have equal weight and effect of law. So they're both equally important, but they have sort of different roles. So something that is session law is often time limited in its significance. So a great example of that is a report that's due next January. It's important. You want the report, whoever you're asking for the report from has to do it. It's a law. But after you get the report in January, you might not need to refer to that language all the time requesting the report. And so the idea is not to fill up the green books with these sort of time limited provisions that are only relevant for a year or 2 years. So we indicate, and whereas other types of law that are significant on an ongoing basis, people will want to refer to them. Those would go into the green books. When you're looking at a bill, you can tell where the law is going by the lead in language. So if we look at this line 15, section 1, first of all, section 1 is telling you that there are multiple sections of the bill. This is the first one. This number 18, can you see the pointer when I move it? I go, great. So 18 tells us we're in Title 18, and there's a green book behind you that is labeled Title 18. That's the book.
Two.
I know we have 2 volumes now.
There's so many laws in Title 18, they had to split us into 2 lines.
VSA stands for Vermont Statutes Annotated, AKA the Green Books. Again, this symbol means section, and then we have the section that we're looking at. So you would go to the book 18, or you'd have to pick out the right one. It's labeled by section, so you would know which volume you're looking at. And then you would pull out, you would flip chronologically, numerically to 9418A and be able to find that language that's being amended. So when you see language, when you see the section header and you're seeing that it's amending the VSA, that automatically tells you we're putting this in the green books. This is going to be ongoing law. This isn't a short, its significance isn't of a short duration. This is ongoing law. So that is what you come to understand by looking at that header. Whereas You'll also see headers that don't use the VSA. So effective dates is a great example of that. So you'll see right here, you have on line 14, section 3, so third section of the bill, but there's no language about the VSA here. So we're not putting anything into those green books. Instead, we're going to have this time, I don't want to say time limited, but the significance of this language is of short duration. Here, for the purpose of setting the effective dates, the effective date usually is within a couple months or a couple years of passage of an act. So once the effective date has happened, we don't need to necessarily hold on to this section that's spelling out the details of it. And that the effective date is noted anyway in the VSA. But this could be a section that says reporting requirements. And then it goes on to list different reporting requirements, reports that are due back in the next 2 years. And that would also not have a VSA heading. Do you have any questions on that? I find it's always confusing.
And it'll make more sense as we continue to see.
Okay, go ahead. Okay, nothing to do with it. How often these books have to get rewritten?
Oh
So-
boy, that's the right person.
Right? So, one of the things we do when you're not around in the summer and fall is we work on updating the statute books. So if you look up at the green books there, you'll see in addition to the green books, there are some white books, smaller white books in with them. Those are supplements that are actually so big that they have to become standalone books. Every volume has a supplement in the back of it, and if it gets too big, it comes out. And so every year we update the supplements with all of the acts that were enacted during the previous session. So during the summer and fall of 2024, we were incorporating everything the legislature passed in 2024. And then every 5 to 10 years, we republish, each volume gets republished. So if you look on the spines of them, right under where it says Vermont statutes annotated at the top, it will have a year. And that was the last time everything was reincorporated. Otherwise, if you just grab a green book and you don't look in the back of it, or if there's a standalone supplement at the supplement, you will not be getting the most recent pieces since the volume was last republished. So that's actually a very important question that you just asked, because a lot of people will just look in the green book and then say, I don't see what we did last year. Well, that's because it's in the supplement, because we didn't republish the volume in its entirety. That we call statutory revision. That's what we do in the big part of what we do in the summer and fall. And I lead the effort, I coordinate the effort for the office. So that's why Katie said I'm the right person.
Yeah, she's a brave and fearless leader every summer, bringing us through that process. It's a huge process. I also, when you're referring to the white books back there, so there is a thicker white book back there. I don't know if it's worthwhile to take a look at some point at that book, but that is a book of, we call it Acts and Resolves. And each year, a book like that is published, and it has every act that was published in that particular year. I don't know how to say this, as the act appeared when the committee passed it. So whereas in the green, when the legislature passed it, yeah, thank you. So whereas the green books, let's say you added a section to Title 33 and you added a section to Title 8. So your language is going to go into the Title 8 Green Book and the Title 33 Green Book, and you'll never see that whole bill in one place in the Green Books. What the Acts and Resolves does is it shows you each act as it appeared when the legislature passed it, when it was enacted. And it has all kinds of tables about keywords and being able to help you find what you're looking for. But if you're curious about what the General Assembly passed in 1 year, you can take one volume, and I don't know what book that is, if it's 2024 or 2023, but that 23. So that's everything that was passed in 23. Oh, yes, thank you.
You do it right on thing.
Yeah, I can do it right here. So you'll get to know this system very well, but when we are amending statute, we have a system of striking through language that is existing language in the statutes that you no longer want to be in the statute. So that on lines 9 and 10, those are strike throughs. And when you're adding language, lines 10, 11, 12, we are underlining it. So that will become intuitive very quickly. So you'll see if if you're adding a new section, it will all be underlined, including the title of the section. But if you're working an existing statute and you're taking out some language, you're adding some language, you'll see strikes throughs and you'll see underlines.
Yeah, strike through is just proposed for deletion, underline is proposed for addition to the statutes.
Did you want to show the next stage?
I
of
did,
the bill?
thank you, yes, good call. Let me stop the share for a minute and look at the other one. Yes, and thank you, Katie, for reminding me that I also wanted to just show you what it looks like. So the bill that we were just looking at had who it was introduced by and the subjects and the statement of purpose of the bill as introduced. And then it went into the actual language of the bill. In this one from last year, which will be familiar to those of you who were on the committee, this is H 414, an act relating to establishing an unused drug repository for Vermont.
Yay!
Representative Goldman was the report. And you can see instead of saying bill as introduced, it now says as passed by House. So that's the stage that we're at and what the bill was and what the peer and at the very top and on line 1, we have what bill number it is, H 414, and the title of the bill, but we don't have any of that. It no longer is relevant as far as moving this bill through the additional stages, at least in this document. This is what we refer to as the unofficial or the clean version. There is a markup version that the House Clerk or Senate Secretary's office puts out that has big red lines through it that still contains that information. But for our purposes here, we're looking at this one where it's just the text and it no longer has the description of what was in the bill as introduced or what the subjects were, and then it just goes into the language. And just to give you another example, in this case, we were adding a subchapter. And so it was something was being added to read and everything is underlined. There was no proposal to strike anything out because it was new. So it's all underlined. And we have several sections going into one chapter. And then you can see the session law sections here that are not talking about the VSA. Any questions on this stuff? And then, we'll talk about, and we'll be refreshing you all the time as we walk through bills. So if you have questions about it when we're looking at bills, we're happy to explain or clarify. All right. I think we're going to move on to using the legislative website. So let me get to.
I'll just say the website is such a great resource for finding material. It's been a long time at this point, but we had a big upgrade a couple of years ago. And the information, it's so much more intuitive than it historically was. So, but with that said, if you need help navigating or finding something, ask us because we're happy to help you do that. So this is the homepage. I'm assuming everybody has spent some time on the General Assembly website. But one of the pieces of information that you'll probably be using a lot is scrolling down on the homepage, and you have a box here for the House, a box for the Senate with important information. So the current House calendar, I imagine you're all looking at the calendar every day and you don't have to navigate anywhere to find it. It's right on the homepage. And likewise, the journal is here too. And then you have your times for your House sessions right on the homepage. It tells you how many bills you have released for introduction today. And there's also streaming links, which you probably won't need, but your constituents might be curious for that information. So there it is. And while you're mostly going to be using the links for the House, there will certainly be times when you are very interested in following your bill that you passed out of this committee and what is the Senate doing with it. And so you might be following along the Senate calendar to see when they're taking that up.
So I was struggling because I wasn't at the Democratic Public Caucus on Tuesday, and I didn't know how to find the stream on the website.
Caucus.
So I think if you go to, we'll be looking at the House tab, but I think if you go to the House tab up here at the top,
Mhm.
and you go to streaming links,
Mhm.
it will give you
Oh.
options for House Chamber and.
Oh, I see. I got stuck when it said Microsoft discontinued, so I thought it was broken. Just look down.
No, not even in Internet Explorer, so it's just, I think, a standard disclaimer.
Okay, got it. Thank you.
That's a great practical application. So you want to start from you're starting with.
I'll start from here too.
Okay.
So if you are doing a quick search, this box is very helpful. If you're looking for a bill that was introduced or an act from this biennium, you can type in a bill number, you can type in one of the keywords that we looked at and see if you can pull a bill up. Again, this will only be for this biennium. So if you're looking for that bill that we passed last biennium, we'll show you how to get that, but you can't get to it by just coming to the homepage without changing anything else. So if we want to see what H1 is, you just type it in, search, and then there we go. We have the title, we have the sponsors, you can get more co-sponsors. We have the committee it was referred to. We have that it was read the first time and the date that it was read. And then we have this box that says as introduced. So this is actually a really important place in a bill's, this is an important piece of information for a bill because you're often going to be wondering the status of a bill. And this will continue to get populated as a bill moves through the process. You can come to the bills page to see more information here. So you'll have the bill as introduced, but then once the bill passes out of the House, you'll have another white box here that will say, bill as passed House, and then you'll have links to the official and unofficial version that moves out of the Senate. You'll get another white box that tells you it's moved out of the Senate. Here's the official and unofficial. You'll get a fourth white box if you have an agreement about the as passed Senate and House version. And then when it's finally enacted, you'll get another box that has the bill as enacted. And we can show you on a bill that has moved through the process what that looks like. But it's really nice if you want to quickly know where a bill is, has a bill moved, to go to the bills page and sort of check out how many boxes it has, and you'll see where it is in the process. I feel like I'm jumping ahead now that I'm.
Oh, I think you're
All right.
great.
Okay.
The question, so on all these various versions, sometimes there's a lot of red X's and things are crossed out.
Yeah,
Can you explain that?
yeah. Thank you. So
Did I miss that? Okay.
No,
You didn't, and thank you for asking that question.
I'm gonna go to 414 from last year and.
And show?
Yeah.
Yeah.
Although 414 may not be good because it has.
always
to
think
largely
of this as the big
same, but,
things.
We just don't look at that.
So you have to go back.
Oh, I go to the-
Ignore that.
I know, but sometimes, how do you do it? I sometimes do it by
Oh.
typing in like H414
Oh,
and then,
from
I choose it here.
the Mount Loss.
Oh, when I do that.
So what Jen is doing is navigating to a different biennium. So what she just did is change from the 25-26 biennium. There's a little box here. It says change session. And there's a drop-down menu, and you can choose which biennium you want to search. So she's going back to the last biennium. And now, there we go. So now we sort of have this flow chart of where the bill is.
If you can see it under, yeah,
Official.
yeah, house one. Yep.
The House looks better. Okay.
Yes.
Um,
Senator just said yes.
So we had mentioned before that there's an official and unofficial version after a bill passes one of the bodies. And that's the question that you're asking. What does that mean? Mostly you'll see the unofficial version from Ledge Council, but the, there we go, Senate Secretary and House Clerk put out these official versions, and you'll know it's the official version, has red on it. But you'll see that there are these big strike throughs. So this shows the bill is introduced and how it was changed. So we know that this language was struck out from how it was initially introduced. So you have this big backward Z that is showing all of this language from the bill as introduced was struck. And it was continued to be struck. So this is what we would have, what we'd call a strike all. The committee that worked on this said, said, you know, we're gonna start from scratch. We're gonna do away with the language as it was introduced, and we're starting from scratch with the strike all. So what you would have seen when you were working in committee would have been just lead-in language that's sort of starting from scratch, instead of seeing all the language struck through. And then the italicized red language is what actually passed. So just to compare, this is the unofficial version. And if you look at, sorry, that's the official version. And if you look at the, oops. Unofficial. Did I? Yeah.
I think you took your screen down.
Okay. I'll get us back. Here is the unofficial version. So this is the same bill. It's at the same stage of passage, but you'll see that you don't have this big red mark crossing out what was in the bill as introduced. You only see what actually was passed out of the House.
So that's why we sometimes refer to it as the clean version, because it doesn't have the big strike through. We find it easier to read, we as staff, and our office creates this version. And so it's not the official version created by the clerk or secretary's office, it's the unofficial version created by our office.
Okay, I always wondered why it was called
Yes,
unofficial.
we never really came up with good names.
Yeah.
Okay,
Thank you.
yes, for what to call them. But we use this one.
Okay. I've always found it confusing that I want to look at the unofficial more than the official.
So we're still on this, we're still on a page that's dedicated to a specific bill. And you have also a lot of information. Besides this kind of bar showing you the status of the bill, there's also a lot of information here. So you'll have a chart of all the different activity that this bill has gone through by date. And you'll see here what happened in the Senate, what happened to the House. Third reading was ordered. It was reported favorably, so that would have been, it was read the second time. So you can sort of follow along with the bill to get more specifics about what is happening and when to a bill on the floor.
And it's in reverse chronological order. So the most recent activity is at the top. Sometimes it goes on for a few pages, but you can also click on the links that are in it to go to the page in the calendar or journal where some of those actions were listed. So it might say that there was an amendment that somebody proposed, and if you click on the calendar or the journal, you'll see what the amendment actually said.
There's a tab for the roll call votes, and you'll see that maybe we can click on it, there wasn't one. Committee activity. You can also get a lot of this information on a specific committee's page, but this will show which committees had possession of the bill and when. So you could see on May 2nd, Senator Probst had it, and this was their agenda for that day when they were taking this up. Staff and other information. So if you are curious about a bill and wondering who can I ask, like which attorney has been working on this, who can I direct my question to? The staff is listed.
And let me just stop there for a second. That one can be really important if there's a bill on the floor, coming to the floor that you want to amend, that wasn't a bill we worked on in this committee, and you want to know who drafted it so you know who to give your amendment request to, you can look that up right on the bill page. You can see staff and under staff and other information, who drafted it, and then you can go directly to that person to ask for amendment. Or you can come to one of us and say, who drafted that, and we'll help you find it. But I find a lot of longtime members even don't know that information is available to them.
If there is fiscal information available, it would be here. Also, probably on committee websites that worked on that. If the bill went to conference, then there would be information about it here. And then we have the act summary, a link to the act summary. The act summary is a description of the bill that Ledge Council writes after you leave about each bill that was enacted.
Just click on it. Just show them.
Oh, yes, let's do it. So this is a summary of everything that was in that bill. And if you're curious and need a description or a reminder of what was in any act, you can go back and get that. And when it is especially helpful is if it was a very long bill and you remember working on it, but you don't remember exactly what it did. That's a good place to get a summary of it. And then this is a list of all the different statutory sections that were impacted by the drafting of that bill, whether they were newly added or amended. And this is a quiz now. So if it says VSA, would that be in the green books?
Green books.
Green books, yeah, not in session law. So that's where the codified list is.
And I just wanted to also show, you can find that act summary right here in this list of the different versions that Katie was showing you. So you don't have to go deeply into it. You can find both as enacted, the final version, and the act summary here in those white boxes.
I feel like I've been talking for a while.
I don't know if this is the right time for this, but I found very useful bills in and out of committee when I'm trying, especially.
We're gonna look
on
at the committee page.
Perfect, yeah.
That's where we're going next. I'm gonna come back to the current session.
Oh, you're looking at the committees tab. I was gonna go to using the committees page. Remember.
Oh, okay.
So I think if you just want to go to the, oh, are you still doing that? Or you want-
No, let's do this.
Or actually,
Start at
that
bills.
was first, yeah.
So we're just gonna kind of go across this blue list. I'm guessing you've probably explored this a little bit, particularly with a lot of new bills being released. But this is one way that you could navigate to different bills that have been introduced this biennium. So released for introduction. So these are bills that probably will be introduced today when you meet at 3.
There are only House bills on there. The Senate doesn't put them up until after they're introduced. So those are always going to be House bills on the released for introduction, but not yet introduced.
Then you have a link to search just House bills or just Senate bills or all bills.
And so do you want to click on the House bills one? Because you get a list, or all bills, but you get a list of, like if you look at the House bills, you get a list of all the House bills that have been introduced so far. So if you know we're up to number 38 and 39, and you're like, what else has been introduced already? You can look at the list of House bills and see all of them by title.
And one feature I really like about this page is that you can do a keyword search or a number search. So if you know somebody told you to look at H65, you could just type a 65 in here and pull up the
It
bill.
has, so in this one where it says refine results, it actually has to be one of the words that appears on the page. So it's not going to go in and do a full keyword search. I think it's just the.
Oh, just the title.
Just the words, yes.
Just the title.
Yeah, just the title.
Mhm.
So it has to appear in the title. So it's not quite as comprehensive as the keyword search.
Also on this tab, you have sort of a similar list of bills passed, and you can search it the same way, vetoed by the governor, enacted without signature. This link bills in and out of committee. Really, it just brings you to the committee webpage to search which bills have been in and out of the committee. So I think we'll cover that when we're looking at the committee
There's
page.
better ways to.
Yeah, I think so too.
But there are often, as you'll see, there are a lot of ways to get to the same information. So it makes it a little bit easier. If you're thinking, well, would it be in this place? It could, you can go to a couple different sources to get to the same information.
So
Do
moving
you want
to
to just a little bit about those?
resolutions.
Resolutions and then the action resolves.
Sure. Yeah, I was gonna do action resolves with Vermont laws. That's okay.
Oh, so you can do it that, yeah, that's fine.
House resolutions. So similar to a list of bills, you get the list of resolutions, you can put a search term in, you can put a search number in and access, try to pinpoint what you're looking for. Couple ways to get this is Jen and I were just chatting amongst ourselves, acts and resolves. So this is looking at bills that have passed. So you'll see that you have no acts yet this session because nothing has passed yet. But you could go back and to last session. And then you get the list of everything that passed. This is akin to that big white book. This is the electronic version of that. And so this is helpful if you had heard that, or you remember, wasn't there a bill, wasn't there an act about X, Y, and Z last year? This is a good place to go and search for that.
And you can refine the results here, and they're written kind of like the way we do the subjects for the bills that are introduced. So if you typed in health, you might find most of the bills that were in this committee and maybe some others too.
May I ask a question regarding, because I was searching for something the other day when we were on the floor. If I recall, it was a resolution, or frankly, I'm still not quite sure, like joint resolutions. But it was around the standing committees and the jurisdiction of the committees.
Oh, yeah.
And we were emailed a copy of it, but there was nowhere, it wasn't in the calendar. I didn't know where to find it.
Katie was just showing you House resolutions. It's actually this first one, House resolution relating to House rules, I believe, that had.
And that was available at the time on the website when we were.
That's not the one.
No, I've had the same problem. I can't find resolutions.
I don't know exactly what these ones that are about arrangement, let's see,
Organization.
yeah, standing committees. All right, let's try that again. All right. So here is, right, this is what you're looking for. What is what were
Would
the
that
changes
have been posted at the time that we were on the floor?
at the time that you were considering it?
Yes.
Yes, probably because it would have been introduced at that point. And when they say an HR 4 and they start talking about it, you can get to it from these House resolutions. You could also get to it, you should be able to get to it by typing HR 4 with or without periods. And whoops, we're still in this one, but back to this one.
Right. Well, thank you.
Yes.
I was searching all over for it.
And
Sorry,
if
Maria,
you find
here's
yourself
something you introduced.
in a bind and you can't find something, always feel free to reach out to us because.
Okay.
You mean while we're sitting there?
Yeah.
Text you?
Can email us, and if we're available, we'll
Text if we're-
Well,
if we're
It's
texting.
hard for me to imagine doing it, but okay.
If you feel like you need to find something and you can't find it,
Yeah.
yeah, or you could, in that case, you could go up to, I assuming you were allowed to walk, I don't know, all your decorum issues, but to the clerk's table and say, where do I find this? And they will help
You
you.
could also text your leadership.
Okay.
Not this leadership.
Or perhaps if others could text.
Right, any leadership that you have.
But clearly not your chair because he couldn't.
Sorry, couldn't mean that.
No, this is great. The next tab is the committees tab. And I think you'll be spending a lot of time going to your committee page. So you can just click on your committee, has all of the members. Importantly, it has the agenda. So you can click right there and that will be pulled up right away. So you can see what your agenda is for the week. You can go back to previous meetings and you can get previous meeting details. There's the link for the live stream. So when you get the stomach bug that's going around, you can, from the comfort of your own home, watch the live stream.
Or not.
And then this section is very important because this has all of the documents you're going to be looking at. So it's organized by day. And so if you were to click on this link, and I'll do it, it will give you all of the handouts that witnesses provided to you. If there's written testimony, or a report that a witness came in and was talking about, that will likely be posted. If you're working on a bill, on a particular day, that version of the bill you're working on will likely be posted. So you can sort of click on the day of the week and you should have access to the materials that your committee will be looking at. So what are you looking at today? Thursday. So you have what Jen and I are going to be chatting with you about next. And then you have documents from witnesses that you met with earlier today. You also have information organized by bill number. So right now, H12 is the only bill that you have listed, but if you click on that, it gives you all the documents related to that particular bill. It's divided into witness testimony and actual drafts and amendments that you've been working on.
And sometimes there's also another folder that's
yes.
public comments. I think if somebody who wasn't a witness invited to the committee, but provided some comments, that would be,
Is there a fiscal tab? Can't remember.
there may be.
Other documents might be things like, you have an orientation folder. It might be things like reports that were submitted to the committee.
Reports.
Oh, thank you.
But sometimes they have, I don't know, an organizational chart or some other documents that don't fit neatly into these other categories.
And witness is a nice way also if you're trying to track something down. You know, so-and-so said something, but you don't know what day it was and you're trying to track down their written testimony. Then you can just search by the person's name and we'll click on Jill and then you have what she submitted to the committee.
There's usually a budget tab or a budget folder on that one that you were looking at.
And the other
I think so, yeah.
documents, yeah, that's a good example. Oh, okay. Should we, as long as I'm on here, maybe keep going with this?
Oh, I'm sorry. I thought I was done.
That's okay.
I'm not
I was
done.
gonna do some of that at the end, but I think it's better now.
Do it, yeah, okay. Also a very helpful tab. What bills are currently in committee, what bills have left committee, what's been referred. So let's see, what do you have in committee now? So this has a list of everything that has been introduced and referred to you.
And you can see them all up on the wall.
And
Kristen
then-
has made a little card for each of them. You have a visual representation on the wall.
You have a hyperlink that will bring you right to the bill page, and we've already looked at what a bill page looks like. Out of committee will be a list of bills that you've worked on and that you've moved out of the committee.
So can I ask a question? Sometimes I struggle with other committees in trying to find a bill that, the status of a bill, so I could find the final version to read before it comes to the floor. And that's where I'm having a hard time locating that.
If you know the bill number, probably the easiest way to do it would be through the documents and handouts and going to bill. And then you can find it by number. And then when you click on it and you look at, I think of these as sort of these are the official attorney drafted documents, and this is people who are not the legislative council attorney. So if you look at this one, there's going to be nothing in this one yet, but this would typically have all of the versions, and there should be one that says something like as recommended by committee on.
Okay, so that would be the language and not a vote. Sometimes there's a vote.
Sometimes, yes, I think and I'm going to actually look at Kristen. I feel like in recent years, you've been directed to put the committee vote in the name of the final reported version. And you may not know that because we haven't been through it yet.
Yeah.
Not to put you on the spot.
Yeah.
Sorry.
I haven't gotten there yet.
Or, yeah, we can check it.
Sometimes that final draft it will say the report of the Committee on House Healthcare.
Report on or as recommended by.
What becomes tricky, I think, is if it's a bill that touches on many different subject areas. I'm trying to think of a good example. Oh, last year you worked on the forensic facility. And it came to this committee, it went to Human Services, it went to House Judiciary, I think it went to Ways and Means, and every committee did an amendment to it. And in that situation, it becomes a little bit trickier to know
Yes.
what you're looking at because it hasn't all been integrated yet. So you're literally having to recognize, okay, so Human Services is amending healthcare, House Judiciary is amending that, and you have to kind of put those pieces together yourself.
That's where I got stuck.
Yeah.
And occasionally we will have done a version like that, you know, like we might have prepared one to bring back here to show you if everybody's amendments pass from all the different committees, here's what it would look like. Often we haven't, but if we have, we're always happy to share. Sometimes we just don't even have the time as everything's rushing around through the committees. Do you want to talk?
I guess I'm thinking about our time.
Oh, okay. Well, I will just quickly mention, so referred to committee, I think, is sort of a combination of in committee and out of committee. In committee means it's been referred to the committee and has not been voted out yet. Out of committee means it's been referred to the committee and it's already been voted out, so the committee doesn't have jurisdiction over it anymore. And this is kind of the all-encompassing list, and then these are committee bills.
You might want to talk about committee bills, because that was a bit of a mystery.
Oh, sure. So what you're seeing on the wall are bills that were introduced by an individual member or group of members. But also a committee collectively has an opportunity to introduce a bill, to work on a bill from scratch in this room and introduce it. And it will be treated just like any other bill once it's introduced and has a number, but all of the work that goes into it will happen here instead of a one-on-one conversation with a particular member who wants to introduce a bill.
While we're on this,
I was just gonna say, why do we want a committee? But like, what's the advantage of it?
there's a couple things, deadlines, there's different deadlines for committee bills.
Yeah.
So the House individual member request deadline, I believe, is next week on the 21st. So that would be next Tuesday. After that, individual members can only request short forms, but the committee in the first year of the biennium does not have a deadline for introducing a committee bill. So an issue that comes up that gets brought to you during the budget adjustment process, or during testimony in the budget, or something happens at the federal level that you want to respond to the extent, Vermont can respond. There are just issues that may arise that you want to address during the session, or there's a topic that the committee becomes interested in, but nobody had a particular idea of how to address it. You take some testimony and then come up with a plan for how you want to address it. Those are some examples. Also on this page, you can change the session again, which can be useful if you remembered something, if you've been here before and you remembered something happened in a prior session and you wanted to go back and see what that witness's testimony was or what was submitted on a bill. You can do all of that just like you can on the current biennium page, but you can do it by changing the biennium and looking around on the page, or the committee page for that biennium. Into laws.
Oh, yes. I guess I should ask, how are you feeling about time? Because we also have
The report.
a report. So I'm
I-
happy to keep going through this.
I would like to end by give people a little bit of time before they have to go to the floor. This, our lunch
And
was
we'll do a
short.
very high level on the rest of the tabs, and then we'll move to the report.
Okay. And we
We
were,
were shoot for 2:45.
okay, we were scheduled to 2:30. I do have another meeting 2:30. I don't know if Jen.
No, I'm good.
Okay.
So I'll step out at 2:30, maybe. Keep going at my
We'll keep
place.
going to the best of my ability.
Say 2:40.
Okay. So we also have this Vermont laws tab. Few different things here. When we click on this, it will bring us to the statutes. It will be a list of the titles. So this is sort of akin to the Green Books. This is the electronic version of that. So we said that you will spend a lot of time in Title 18. So you scroll down to Title 18. You will click on it and you will see that it is organized by chapters. You have an indication of what the chapter is about by the title. And then clicking on that will show you each of the sections. within that chapter. And clicking on each of these will bring you on the exact statutory language. So if you're curious how a particular chapter is organized, you can kind of see it represented well by going to the website. Going back to this tab, you can also search a statute. So you can, if you'd like, you can narrow down by the title. And you can pick a word, pharmacy, or a combination of words. And then you'll get a list of every statute, every section in Title 18 that has the word pharmacy in it. Also within this, so acts and resolves, this brings you to what we already looked at, which shows you all of the acts that were enacted. You have the Constitution of the state of Vermont, also important. I use this, you may use this. This is the a link to the agency rules. So if there is a question or if you're trying to figure out how to find the agency rules, it's available here, but in the interest of time, I won't spend too much time going through that.
Another thing to just, I would mention here is that you can do a search, bill, act, and resolution search. And on that, if you follow that link, you can search by the number, if you know it, either bill or resolution number, act number, keyword, and or sponsor name, and then you can do a full text search. And you put things in, quotation marks if it was a phrase. And so it changes where you type, depending on what you're searching for. It's good, but not great, I would say, our search function at this point. So sometimes there will be back-end coding issues that mean that results don't pop up. If you're having trouble finding something, let us know and we will work with you to try to find it. There are tabs here for the House and Senate. I'm not really going to show you much on the Senate, although it's similar to the House. But just if you're looking for, if you want to read your own bio or your colleague's bio, see pictures, you can look, learn more about the clerk under the House General here and the officers. Here's another place you can find calendars, journals, House bills for introduction. I did want to just highlight here the House rules. So the House, as I know you've heard from the clerk, is governed by its own rules. You've adopted and amended some, but this is where you can find the House rules. The same for the Senate. Joint Fiscal Office tab takes you to a separate website. Theirs is organized differently. And you can play around with that one and ask Nolan if you have questions. Reports of
An
research.
enigma tab.
What?
I find that tab to be an enigma.
Yes. Then on the reports and research tab, this one is important to know about because it's on the left-hand side here under find legislative reports that you're actually going to find all of the reports. And again, you can refine the results by typing in a single word. So if I typed in health, it would bring us everything that either had health in the report name or was submitted by an entity with the word health in its name. Also, in this tab, you can do lots of research. Witness history is a good one if you're looking for where a particular witness may have testified. You can change the biennium. You can search by subject history. There's some information about Public Records Act exemptions. There's all kinds of stuff to find on here. Over here, there's information about the State House and visiting the State House, how a bill becomes a law, things your constituents might be interested in, or you might be interested in. And then staff and offices. And there's some links to learn more about all the different offices.
Maybe you could, there used to be a map of the House. They used to post the map of the House floor with all the members.
Yes, so
I haven't been able to find that the last couple of years.
under the House tab, and you go, I believe it's under House Overview, you can find 25, 26.
Thank you.
Yeah, it just got posted.
It takes them a while to update when everybody gets.
I guess and look up legislators by their last name and see their house number and then try to get closer.
A couple of other things just to know, there's even more down at the bottom. There's some links for legislative email, time reporting, expense reporting, links to the other branches and constitutional officers, state agencies. There's also a legislative schedule that actually has some fairly useful information about when there's and certain deadlines. Oh, I'm sorry, 31st, not the 21st. So you have 2 weeks from tomorrow to submit your standard form requests. So that is the legislative website in a nutshell. And now we will put up our reports, start running you through all of those. Let me just make this a little bigger. And so this is our annual reports due to this committee, as Katie said, basically from when you adjourn, after you adjourned last year until the former legislature, former General Assembly adjourned until we really do them for all the ones we know of that are coming up, but we kind of separate them out from late spring into a future reports section. And we've put links in, included links for everything that's come in and been posted on the legislative website. If somebody thinks something's been should be posted and isn't, then like I just told Mike Fisher how to find the information about how to submit. You have to submit it through a very particular process on the reports page. So people shouldn't send, anybody listening, don't send it to Kristen or the chair. It has to be submitted through a particular process. And so we're just going to remind those of you who are returning and briefly explain to those of you who are new what all of the reports are.
Okay. Yes, I'm starting. 2 years ago, this committee worked on a bill, Act 56, related to suicide prevention. So the first report on your list is a result of that work. So this is the statewide strategic plan pertaining to suicide prevention services. And this report identifies statewide goals, partners. It develops and identifies strategies and emerging resource around suicide prevention. So that came in July. So, in the same act, this committee requested a model protocol for healthcare facilities on suicide prevention, education, and post-pension services. So this is a model protocol for healthcare facilities. I want to say 6 months previous to this coming in, you also had a model protocol for, I think, educational settings. So that is something we would have talked about last year.
Next, you have the first of, you'll see this show up a few times. There's a Medicaid program enrollment and expenditures quarterly report that gives up-to-date numbers on enrollment and expenditures in the Medicaid program. It's usually short and just numbers. So there's a lot of information there. So that's the one from September, but you'll see it come up a few more times. There is a report that comes in every year to the Joint Fiscal Committee, but I thought would be of interest to this committee on what's in the Health IT Fund, Health Information Technology Fund, what's come in, what's gone out, and what do the balances look like. That comes from the Agency of Administration. Next, we have the Green Mountain Care Board's annual bill back report. The Green Mountain Care does a lot of regulatory work, and in that work, it is authorized to charge the regulated entities a portion of the cost of doing the regulation. And so there is some discretion for the board and how they exercise that authority. This is an annual report in which they say what they could have billed back, what they actually billed back, and any additional information about that formula. Next is the Global Commitment Investment Report. I think you looked at this briefly yesterday as part of Nolan's Medicaid 101 presentation. It's the very tiny words on a very long list. And these are the things that Vermont is able to use federal Medicaid match for under our Global Commitment to Health Section 1115 demonstration program that otherwise would not be matchable with federal funds. Then we have the annual report from the Department of Vermont Health Access on pharmacy best practices and cost control program. This is looking at prescription drug expenditures in the Medicaid program. What were the amounts? What are the trends? What are the cost drivers? So that came in at the end of October. Then we have the Health Information Exchange Strategic Plan. So this is about the flow of electronic health information through the state's Health Information Exchange. There is a 5-year strategic plan, and this is an update, the 2024 update to that 5-year plan.
Next report is the psychedelic therapy advisory working group. This group was created and met over the summer, and their final report was submitted. After that is the competency restoration fiscal estimate. So there's discussion about the creation of a competency restoration program, meaning that people who are incompetent to stand trial, likely due to mental illness, could possibly participate in a competency restoration program to regain competency and be able to stand trial. So this report was a fiscal estimate, how much it would be to operate a program like that.
Next, we have the next quarterly installment of the Medicaid program enrollment and expenditures report, followed by a report that actually was not based on legislation from this committee. It was from the OPR bill, but the results were to come in part to this committee. And this was from the Naturopathic Physician Technical Advisory Group established in the OPR bill to make recommendations on integration of naturopathic physicians into certain statewide policies. And this was, the policies themselves are more down the hall. You may have heard about this on the radio recently because the report came out a couple weeks ago. But whether to allow naturopathic physicians to sign do not resuscitate and COLST clinician order for life-sustaining treatment orders, whether to allow them to sign as the clinician on certain clauses in an advance directive, and whether to allow them to participate as physicians do in the medical aid in dying, patient choice at end of life process. Next, we have an annual report from the Office of the Attorney General on prescription drug cost transparency. This is a result of legislation passed a number of years ago now by the House Healthcare Committee that has reporting on certain drugs that had a particularly steep increase in their cost, either in a short period of time or a much larger one over a slightly longer period of time, and talking about some of the reasons for those increases. Next is a report from the Green Mountain Care Board on reference-based pricing and a data analysis, and it has some thoughts and some recommendations from the Green Mountain Care Board. So this is separate from the one just looking at or a broader application than just the public employees.
And that's the one that Erin is summarizing for us.
Okay. Great.
The next report has to do with the licensure and regulation of mental health professionals. The General Assembly asked the Office of Professional Regulation, OPR, to look into streamlining the mental health licensure and having possibly one licensure with multiple endorsements. The next report is an annual report of the Mental Health Crisis Commission. This is a commission made up of mental health providers, crisis workers, law enforcement, and this group sort of does a deep dive into how one or two incidents played out for the purpose of sort of getting lessons learned that apply to the whole mental health system, gaining some insights that can be applied more widely than to the particular incident or incidents under consideration.
Next, we have the annual report from the Office of the Healthcare Advocate. As I mentioned, Mike Fisher thinks it was submitted, but it wasn't done through the right channel. So hopefully there will be a link soon. He says it is done. Next are two reports that aren't actually submitted here. They're really required to be posted on the respective entity's website. So the first is notice of introduction of new high-cost prescription drugs. This is notice that has to come in to the Office of the Attorney General when a drug manufacturer is going to introduce a new high-cost drug to the market. And so they have on their website the most recent one, which is for covering the period July to September 2024, and you can see all the notices from the manufacturers there. There's also from the Green Mountain Care Board and on their website, the impact of prescription drug costs on health insurance and premiums. And that is an annually required report that is posted on their website.
Next is a report from the Agency of Human Services. This is a quarterly report as the appropriation to expand high-quality mental health and substance use disorder treatment professionals.
And I think I wrote some of that language. So I think they were given money and were supposed to be reporting on how they were using it and whether it was effective. Next was this committee's returning members may remember a sunrise review of doula regulation. This was looking at the potential for, or the bill was looking at the potential for Medicaid coverage of services provided by doulas before, during, and after after childbirth. And so as part of that, there was a request to the Office of Professional Regulation to do what's called a sunrise review, where they look at regulating otherwise not currently regulated profession. And they were directed to pick one of the forms of regulation. So I'll do the spoiler alert. Certification is what they have recommended. It's kind of the intermediate level.
Wait, really good.
All right.
Registration, certification, licensure. Yeah.
Next is a report from the Department of Mental Health. This comes in every other year. Conditions for treatment of patients in hospital, and also a look at whether there is enough community services in the mental health system. In 2023, in the budget, in addition to doing some increases to dental provider reimbursement rates in Medicaid, there was also a directive to the Department of Vermont Health Access to look at what the impact is of making those rate increases. And their report not only addresses that, but also provides an overview of the Medicaid dental benefit. So if you're interested in learning more about that, it's in there. There was a move to hire a crisis specialist to be embedded within the state police barracks. So this is a report on that topic from the Department of Public Safety. I have not been able to find the statutory citation requiring this report. What's listed there is a presentation that is requested, but not a required report. Nevertheless, you have a report, so as part of the budget. Well, this is part of the budget. It was a presentation, though.
Yeah, it was a presentation.
Yeah.
Next, we have a technical analysis of Vermont's health insurance markets. For those of you who were here last year, you may remember this as a piece of the Medicaid expansion bill that you voted out. And as part of that, you asked, and that language ended up, even though that bill did not pass, some of that language, including the technical analysis of the markets and whether they should remain unmerged, among others. Other aspects was put into the budget, and that here's the report. Also from the budget, there was, and language that you had talked about, I think was from Department of Vermont Health Access, providing some analyses of Medicaid rates and how they're determined, what the methodologies are for home health services, and for using the resource-based relative value scale, the RBRVS, for those of you who recognize that acronym, how that fee schedule maybe should be or could be updated or benchmarked differently in the future. Also from the budget, going along with the expansion that was enacted in the budget, through the budget originally from your Medicaid bill, of an expansion in eligibility for the Medicare savings programs that were mentioned a little bit the other day. There was a request to the Department of Vermont Health Access to look at whether and how the VFARM statutes should be, and programs should be changed to align with that expanded eligibility. So the report is back on that. Hot off the press is this next one, private right of action for violations of the pharmacy benefit manager laws. Remember that was became a contentious issue for those of you who were here last year. At the end of your work on the PBM regulation, there was a question of whether there should or should not be a private right of action. And you asked the Department of Financial Regulation to look into it and get back to you. I'm happy to spoil it for you if you want, or you can read it yourself.
Go for it.
Yeah. Yeah, they said they still don't think there should be a private right of action. I read it. Next up, also new in is, because these were just due yesterday, from the Green Mountain Care Board. You may recall, those of you again who were here last year, the Green Mountain Care Board was tasked with looking into how to regulate prescription drug costs. And so they were to come back with a preliminary plan and then followed up with a final plan. So their preliminary plan or their preliminary report was just submitted. I think it's you.
Okay. Next is an annual report from the Agency of Human Services. This is an inventory of all AHS grants that are issued in the previous year. As you can imagine, an agency with 6 departments, that is a big report with all of the different grants that moved through the agency. After that, we have the Human Services Board annual report. The Human Services Board hears appeals from decisions made by the Agency of Human Services. So this report covers the number of fair hearings that happened in the last year, the number of decisions that were made. I wasn't sure if you were community or if I was.
I think you are.
Okay, Community Violence Prevention Program. This is an annual report from the Department of Health, and it covers how various grants were issued and used in the previous year. The report of the Health Equity Advisory Commission. This is a standing commission that, as the name suggests, looks at issues of health equity across the state. And every year they have an annual sort of status report on their work. So that is what that is. The same piece of legislation enacted or required an analysis of health equity data every year. So this is statewide data that's analyzed by the health department.
So how do we need to make, oh, sorry.
I'm sorry, go ahead, Leslie, I didn't see you. I'm actually really engrossed in these reports.
Well, I'm just really interested because there's so many that are annual. And how do we know that they still have value? And how do we then address
That's an interesting question.
Last year, we went through
Yeah,
and we determined what we felt still had value. And those are the reports that are not necessarily that they're not being done. It's that we're receiving the ones that we
thought had value.
thought had value.
And is that worth doing again?
So
Or not?
So what happens is, most years, House GovOps will send out a list to the policy committees asking if you still want certain reports. There's a statutory sort of 5-year alarm clock that goes off, and it directs them to ask you, do you still think this report is important enough to keep? You might mark the report as no longer has value. Another committee might say, actually, we use this report all the time. Please don't get rid of it. So that might be a reason that it stays. But also, just because you have sort of checked the box that says healthcare doesn't need to receive this anymore, until there is a bill that repeals those reports, those reports continue to be required. And that report repeal bill has not happened in many years at this point.
Does that come out of GovOps?
That
Typically.
Is there a document that still exists somewhere of what, say, the healthcare committee last year decided was not?
We have to confer with our colleague who collects those, but I
Okay.
would imagine.
I don't think it's something that Jen and I have held on to, but it could
I
be
think
that
we turn
the,
them into Tucker and he creates the master list.
I remember the conversation for sure.
Yeah, I worked on that with Representative Peterson.
Yeah, that's right.
Wouldn't it be on YouTube somewhere too, if someone really wanted to see it?
Well, how many days do you want to look at YouTube?
I'm just saying though, that there is a public record somewhere, if someone really wanted to find it of the conversation.
No, I'm more thinking about.
Let's move on.
here, I'll make.
There's a lot of reports.
Okay, so we're not done yet.
Yeah, I know. That's what I said. Let's move on.
So the next one is
And Katie, if you have to go.
I'll finish the page and then I'll run out.
the annual report of the maternal mortality review panel that looks at deaths during pregnancy and within I believe a year postpartum. Next is not a report that's actually due yet because the wholesale prescription drug importation program is not operational yet.
The next one is a DMH report. It's an annual report. The extent to which individuals with a mental health condition or psychiatric disability receive care in most integrated and less restrictive settings available. The name mostly says it all. But this looks at capacity at each level of care, and it also looks at patient experience.
All right. Next we have, what? Oh, thank you. Next, we have the
Thank you, Katie.
Vermont Information Technology Leaders Vital Annual Report. So they're the ones who by statute operate the Vermont Health Information Exchange. We also have the Green Mountain Care Board's annual report, and in their enabling legislation, there are a number of things they are directed to report on annually. So there's a fair amount of information in that report, might be useful to look at. There is a requirement for the healthcare expenditure analysis. I could not find one more recent than 2022 on the Green Mountain Care Board's website and nothing on ours. So I think there may be, to my recollection, there's some mismatch on the timing between when it's due and when information is available. But there also is, I did not find anything more recent. Next is based on some language that was in the Emergency Medical Services Bill that this committee and the Government Operations Committee worked on last year. And this is due as part of the budget presentation, so it's not in yet because you haven't had a budget presentation yet. But it asked the Agency of Human Services to report on what it would cost if all emergency services providers were reimbursed at Medicare rates, if they were all reimbursed at 100% of Medicare for all services provided to Medicaid beneficiaries. So you may recall there was a requirement to do a small piece at 100% of Medicare, that treatment without transport. But you wanted information about what it would look like for all. Next, we have the Clinical Utilization Review Board annual report from the Department of Vermont Health Access. We looked at potentially making some changes last year to that in the Medicaid expansion bill. Those did not happen, but it'd be interesting to see if they incorporate some of what we were interested in. The next is an annual report that's required from an independent consultant working with the Department of Mental Health. And it's an independent evaluation of the administration of involuntary non-emergency psychiatric medications. That report has come in. Next is an annual, over the course of several years, report from the Agency of Human Services, giving an update on their process in addressing some federal requirements from the Centers for Medicare and Medicaid Services to reduce federal Medicaid spending on Institutes for Mental Disease, IMDs. Next, we have also from the Agency of Human Services, as part of the budget adjustment presentation this year, they're supposed to give you an update on the status of their rulemaking for the unused prescription drug repository program that we were looking at as one of our examples of legislation that had passed. Next is annual for a few years, a joint report from the Department of Mental Health and the Department of Disabilities, Aging and Independent Living, with population data on the people who are in forensic facilities. I'm not going to know anything if you ask me a question.
No, I'm just sort of thinking about process. Back to the unused drug repository, AHS, somebody over there is supposed to make a presentation. And how does that happen? Who do we invite them in? Do you invite them in? Do they automatically do it? What's the process?
It can be any number of those. I think in an ideal world, they would include it in their budget adjustment presentation because they would be remembering
It'll just be one of those
this
little
requirement, and it might be a slide in their presentation or a couple of slides. That said, if they don't include it or you wanted to hear it at a different time, the chair could work with the agency on how best to get that information.
That's just an example because it comes up all the time.
And the chair spends her weekend going through this list, writing down all the things that she needs to send out an email saying, we'd like that presentation.
Thank you. That's the glory of chairness.
Daisy.
I just want to flag to Jen that I think it is important, as Alyssa and I were looking at this list, there are several reports on here that last year we flagged as duplicative, like the Act 114 report from the Department of Mental Health. They're paying a consultant to do that.
Well, there were two
Yes.
required, and one of them was eliminated.
Yes, but they're paying a consultant to do it. And as far as I know, they were not supposed to renew that contract 2 years ago. Anyway, we need to look into that because they're paying a contractor to do it, but in statute, they're also doing it themselves. It's completely duplicative. So
The one they're supposed to do themselves is the one that was repealed last year. So that is not, because we deleted that one from this list.
yeah, and we need to look at why we're having them pay to do one. Why not save the money and have them do their own 114 review?
That
Let's talk about that.
Yeah.
Yeah.
Yes, and you may want to talk to your colleagues in the Government Operations Committee about doing a reports repeal bill if there are others that you want to see eliminated. All right. Next we have, and now we're in the ones where the due date has not passed. A few of these with the present budget adjustment and budget presentations also deadline has, or the due date has not passed. But at the end of this month, you're supposed to get the first, I believe, update from the Agency of Human Services on the status of gender affirming healthcare and reproductive healthcare readiness at Vermont's higher education institutions. It was passed as part of Act 15, one of the shield bills. Next, you have an annual report. I'm not sure it has a specific due date, but a report of the Emergency Service Provider Wellness Commission. That one has come in. Also, at the end of this month, you have the Blueprint for Health annual report due. And at the beginning of February, kind of the first of two presentations on the status of recommendations for re-envisioning the Agency of Human Services. And this was either could be a report or a presentation. We've given them some latitude to decide. But this is whether the Agency of Human Services should be broken up or reconfigured in some way to maximize its ability to provide services. Then we have some future reports. We can go through these or not, up to you. These are ones with later out effective dates, but we're also kind of finding these useful. I guess some of these aren't too far out, but finding these useful for our purposes and just keeping track. We use this year's report as a basis for the next year's chart. So I don't know if you want to see these or not.
No, that's fine.
All
I
right.
think we're,
And you're at max capacity and at 2:40. Look at that.
Report it out.
Daisy has a quick question.
Jen,
Yes.
you are one of the most knowledgeable people that comes into this room. And I'm astounded that it seems like you read a lot of these reports. Do you?
I try to look at them and at least understand what the recommendations are that are coming to you.
Thank you. I just was nosy is all.
I think especially when we've worked on requiring the report as part of legislation, I'm particularly interested in what the outcome is, but I'm also looking at what we might be continuing to work on depending on a recommendation.
Yeah.
Leslie?
Do you feel really reading the executive summary is sufficient when looking at these reports?
I don't think I can answer that question.
I can answer that.
I think, people put significantly more effort into it.
You were.
Yeah, no, I would.
That's what I'm thinking. So yeah, so read more is what I think.
Yes, I think there's often a lot of data.
Go deeper. So it's worth going deeper because sometimes, yeah, I get it.
Brian, did you have a?
Well, it's hard to read all these, I will say that, and I try. And something I would just like to put out there for us to consider is maybe finding a way to do like working meeting or something where we read something, like we build time to read a report into our schedule when we're considering the issue. Like it might even be like, we're gonna read 15 minutes together and then the witness comes in or something, because it's hard. It is better when people read the report because then it prevents stupid questions. I mean, I shouldn't say stupid questions. It prevents questions that could have been answered by reading it.
Just repetitive questions.
Yeah.
Or we could come up with a book report.
I like that. I like that idea though.
Where basically somebody takes a report and then summarizes it for the rest of.
That's exactly, this is what I'm getting at. This is what I was getting at. Some way to like,
But let's think on that.
yes.
And some committees do divide up responsibility for reading reports. People pick particular ones and report back.
That's good to know then.
Long day today, I feel like.
Oh, yeah.
First of all, Jen and Katie as well. Really, honestly, thank you for this. I know that you two put a lot of work into this. The reports, I will just say for myself personally, the reports have always been a struggle for me to understand and to find them, to know what is really pertinent, because there are so many reports. And there is some very, very important information in a lot of these. And you may not read them now, but we may have an issue that'll touch on, and you want to remember, wait a minute, there is a report out there and it will give you a little bit deeper dive. We asked for these reports for a reason. So we should use them.
update the links over the next couple of weeks as more reports.
And can I assume even if it doesn't have a link, but the due date has passed, that means that we haven't received it yet?
It means it is not showing on the legislative reports page. So, or we couldn't find it on the legislative reports page, but we tried to.
Sometimes it's-
on that. Yeah, but often it's either that it hasn't been submitted or it hasn't been submitted properly.
So thank you very much.
Thank you very much.
And with that, I think we're gonna end for
Thanks
this
for that.
day.
Well, I could ask on down low.
Yeah, please.